Hi, everybody. Today, caregivers are asking the question, should elderly parents have surgery? This is a great question to ask. You know that I always support asking questions to really figure out what needs to be done. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. You can find a lot of helpful information on my website at pameladwilson.com. So let's talk about how to figure out, should elderly parents have surgery? One of the first questions that you want to ask or things that you want to look at is the current health condition of your parent and their physical ability and cognitive ability and day-to-day activities. So in a sense, why is the surgery needed? Is it needed to correct something that is preventing your parents from having a good quality of life? So for example, let's say that your parent falls and breaks a hip, and the day before they ran 5 miles. Well, then it would make sense to do the hip surgery so that they can get back to the previous level of physical activity. Then let's take this to a totally other extreme. Your parent is diagnosed with Alzheimer's or dementia, and in addition to that, they have heart disease and diabetes and COPD and arthritis. And their daily life, their quality of life is really very poor. They don't get up much. They either spend a lot of time in bed or a lot of time in a lounge chair watching television. They don't do a lot. They're tired all the time. They don't feel well. In that case, if your parent broke a hip, the discussion of whether to have surgery or not is something that hopefully you had previous with your parent about extensive life extending care and how much care they really would want. Because you have to look at a number of things, and these are not easy answers. They're emotionally challenging. But if your parent is really sick before the surgery, what's the likelihood that they're going to be better after that surgery, especially if they have dementia or Alzheimer's? Because you may or may not know, but the anesthesia that is used severely affects people who have cognitive problems already. And let's face it, if you're 90 years old, surgery is going to be hard on the body. Anytime laying in a hospital bed or having some invasive procedure done, for somebody who is that age, it's going to be very difficult to do the physical things to recover. So you really want to look at, what is a parent's life before this issue? How can the surgery improve it? Will it improve it? To what degree? You know, if you're going to get a 5% improvement, do you really want to put yourself or your parent through that type of trauma? Because surgery is trauma to the body. It's invasive. There are a lot of risks. There are a lot of things that can go wrong. And I have many caregivers in my support groups who will have an elderly parent with a lot of health issues or dementia or Alzheimer's and a lot of health issues. And they're thinking about surgery for a number of things because it seems like the obvious thing to do, right? Your parent needs surgery and you're just going to do it. Well, that may not be the best for your parent because I've seen it go both ways. I have seen with my clients over the past 20 years and with caregivers in my group, the surgery goes wonderful and there's a great outcome. But many times the surgery doesn't go as expected and a parent is worse, and then they end up in a nursing home and then they pass away very quickly. So instead of doing all of this invasive treatment that involves surgery, might it be better to look at what is called comfort care? And sometimes it's called hospice. And people I know are very uncomfortable with the word hospice care because they think that it means end of life. But truly, if your parent has so many health issues and they're not doing well day to day, are they not already approaching end of life? You're just not calling it end of life, or you may not know that it's end of life. In this case, hospice care can be such a wonderful support for parents who truly may be in their last 6 months of life, or their health is just not going to get better and they're suffering and they're in a lot of pain. Hospice care is actually care that comes into the home. It's not always necessarily a place that you go or you have to leave home to go to. A lot of people are very confused about that. But hospice care brings medical care into the home. So nurses, hospice care workers, medical equipment, managing medications, a lot of support services that can make sure that your parent is not suffering and is not in a lot of pain, and that they get the care that they need and provide support to the caregivers. Now, there's a lot of things that hospice does and doesn't do. That's for another video. This conversation really is to talk about, should my parent have surgery? What are the benefits to surgery? Will they be better after surgery than before? How will this affect their daily life? Or will this really just cause more health problems? And should we look at something like bringing hospice care into the home? I'm Pamela D Wilson. My website is pameladwilson.com. There is a lot of hope, help, and support for caregivers and aging adults there. Here on my YouTube channel, hundreds of videos answering caregiving questions. Thank you so much for being here. I will see you all again soon in another video.